Our next paper is Reconstruction of Human Anatomy using Three-Dimensional Printing, Aorta and Liver Models by Dr. Rahul Gupta, who will present this.
Good afternoon. I'd like to thank Sages and the President, Dr. Herron, Dr. Clemens, for giving us the opportunity to present our work today. What I'm going to present today is a reconstruction of 3D anatomy using three-dimensional printing and using conventional imaging as the source of these three-dimensional printing. We do not have any financial disclosures, but we would like to thank Milton F. Fund for giving us the grants for continuing with this work. Objective, as stated earlier, is to create clinically relevant three-dimensional models from conventional imaging. In the technique, the first step is to take conventional images. In this scans, we've taken a CAT scan, and basically the isodense areas in scans are marked out as surface rendering. This is actually done manually in the first step, and you can see that on the bottom corner there's a surface rendering of the organ in question. These surface rendering are spaces. Now they're converted into a three-dimensional depiction using something which is pretty physical. It's called standard tessellated log. In layman's term, you create a space and you convert into millions of isovolumetric prisms. The problem with this prisms conversion is that if you see these models very closely, they have roughened edges. So the next step is to smoothen these rough edges and to have a surface contouring which is pretty normal, or which is there in the normal anatomy. The same steps are carried down for the arterio-venous anatomy and the pathology in question, and this time it was a Klatskin tumor which we were trying to reconstruct. The liver shell creation is the next step, as we need to create a shell, and in future we'll be inserting the internal structures inside the shell. So this is the carving out of the liver shell. And the previously created images of the arterio-venous and the pathology are merged into a single final three-dimensional model which will be used for printing. The models were printed, the shells were printed using a technique called Stereo-Lithography, while the internal structures were printed using a multi-jet printing machine. This is a Stereo-Lithography. I'll show a video how it works. Basically, it's a liquid crystallization by laser. You can see the laser moving in the liquid and it crystallizes those liquid. And this is actually depicting a three-dimensional model which we just created from CAT scans. The results are basically, we got two generation of results. This is the first results we got, and this was basically the model itself was very friable, unstable, and we took care of these shortcomings, and we got the second generation of results, which are here. Coming on to the second model we created was an aorta. The initial procedure was the same, surface rendering, where isodense areas from the CAT scans are marked out and the surface rendering is done. The second step is the same, standard tessellated logs and surface contouring, contour reconstruction from the back. And after discussion with the vascular surgeons at our place, they really wanted that if we could put in thrombus, that would help us in creating a more actual image of the pathology. So there we created a reconstruction of the thrombus, and this is the completed final simulation. It was again printed, and this is the first generation of results. This is without the thrombus. It is just the shell printing of the aneurysm, and this is the final, the second generation of the models we got. And we also elongated the iliac vessels because they probably wanted to see the landing zones for endovascular graft. The proposed applications for these model creations, although they're a little expensive right now, is to understand patient-specific tortuosity and also preoperative selection and sizing of the graft. I think you can have a better understanding of the landing zone as well as distance from the renal artery if you were to extend these models upwards. The liver models do have applications in live donor liver transplantation because based on these models you can create anatomic functional classification as well as hepatic vein dominance patterns. You could also map out congestion segments, and you can also have virtual resections, and based on these virtual resections you could calculate the graft host and graft donor ratios. And these are very important for especially livers which are unequal in size, or the right or the left lobe right lobe is bigger than the left. So, and in terms of Klatskin tumor, I think it can help in predicting the complexity of bilioenteric anastomosis. It does have some more applications. It does improve our ability to communicate with our patients and their specific pathology, and it could be used for a preoperative discussion and acquisition of anatomical knowledge in a real-time scenario with the residents and fellows. We can use this as an adjunct for testing and education also. I'd like to conclude by saying that 3D printing can be used to create personalized patient-specific models to replicate human anatomy and pathology, utilizing conventional imaging as a source. The spatial orientation and accuracy is currently limited by the complexity and multiplicity of the tissue depictions, and further development may resolve these shortcomings. The one point I'd like to add on this is that right now we had the multi-jet printer available. The most advanced is a 3-head printer, and 1 head is always used to, basically, since you're printing in 3 dimensions, you have to print out the support system for that. So you can only print 2 organs at one time. And aorta was a good model because we just had 1 tissue to print. But with liver, the interplay of the parenchyma, the artery, the veins, the liver model, the first time, it didn't come out as well as we expected. But hopefully, I think we can take it further down and improve on that. Thank you.
If anyone has a question, please come to the mic. I was curious, who would you partner with in Nashville? Who should I partner with in Nashville to try to find out how to redo what you've done? How do I print in 3 dimensions in my hometown?
Well, I mean, these printing, I mean, the model we print goes to New York, actually. We do the initial software. It's called the Mimic software, which is available. It's not something I did. We have help in terms of people who are trained. The person we actually work with is Mr. Weinberg, and he had some training, and he helps us with this development of these softwares, and then these models are printed in New York right now.
Okay, very specialized. Yes, sir.
Hello, my name is Howie Chosit. I'm at Carnegie Mellon University. What I was wondering about was what kind of material properties do these prototypes that you produce have? And really what I'm getting at is what happens when you're trying to replicate organs that have heterogeneous structure? How are you handling that?
In terms of creation models, it's like a process in evolution. The first model we used the structures which were very friable, the mold started to fall apart. But then we started using some resins. I probably don't remember the name of the resins, but the second mold came out much stronger. You could actually hold in your hand and move it around and actually play it from all the angles.
So is it soft or hard?
It is hard.
Okay.
Thank you very much.
Thank you.
Nice.
Thank you.
Done.